So, sex, love, and aging are all different things, and sometimes they're related. What we refer to as your sex life might look different than it did 40 years ago. Heck, you probably look different than you did 40 years ago. I'm Dr. Kelly Rees, and I'm a clinical sexologist with a practice here in Portland. I see couples and individuals. I also teach sexual health at a drug and alcohol recovery center. And I'm so happy to be speaking with you here today with my wonderful colleague, Anna Marti.
Thanks, Kelly. First of all, I wanted to say happy Earth Day. And there's a correlation to our subject. Our bodies are comprised of all the materials of the earth: water, earth, air, fire, our nervous systems, and our relationship to our bodies, how we care for them, how in connection we are with them, our felt sense of them, is directly related to how we connect as sexual beings. There's also relevance because as I become more conscious to these elements in my body, the hope is I become more aware of that relationship to other people's bodies and this beautiful planet that we're living on. So consider that today in our talk, that care that we can give ourselves, that care that we can show one another, that care that we can create here on the planet, and also the primary element of sexuality, which is connection. Connection primarily to ourselves, connection to one another, and of course, this connection to the planet that for many of us living in the West, it's easy to lose contact with, and particularly in the last year during COVID, where so many people have been isolated. Like Kelly said, I'm Anna Marti. I'm an intimacy coach, and I have been I've been in a private practice in Portland, Oregon for over 25 years. I'm the old one on the panel. I'll be 71 next month. I work with individuals and couples of all genders, orientations, relationship styles. I want to give a disclaimer as well. I'm a white cisgender woman. Cisgender means I was born in a female body and I'm presenting as a she, her. We really work with our language, but we want to acknowledge the wide variety of experience. And I can only talk from the one that I'm living in, but I will be as conscious as I can. I began on this path, I would say when I was like 11. And when I was 11, I came to the foot of my mother's dressing table. She was putting on lipstick, getting ready to prepare dinner. And I asked her, tell me the facts of life. Of course, I had no idea what I was asking. And she was very taken aback. And all she said was, don't let any boys put their hands down your pants. Well, I couldn't figure out why anybody would want to. Flash forward a few years. I get pregnant when I'm 16 years old. And it wasn't because any boys put their hands down my pants. I had an illegal abortion in 1966. And that lit a fire in me of wanting to understand and wanting to know. And what is this confusing, mysterious, powerful force that seems to pervade all of our life? I'd like to make an introduction just about what healthy sex is before Kelly says what we're going to cover. So you can reference that. Healthy sex is consensual. It's without coercion, it's without bargaining, it's without strings attached. It is not transactional. Healthy sex is pleasurable. It feels good. Healthy sex involves awareness, which means I don't have to check out to be engaged with you. And healthy sex is with connecting. And that can be connecting with myself.
Nice. Hopefully you will be connected with yourself. Yeah, that's the first place to start. So today we're going to talk about changing bodies and changing lives. That change is real, but it doesn't have to take you down. And we'll talk about the different ways that we change over our lifespan. We're going to talk about practicing sharing your feelings, your fears, your triumphs, and why this is important and why it's so scary to do that sometimes. We're going to talk about countering unrealistic expectations and finding realistic models so you can have a satisfying sexual or intimate relationship if you want to. Okay, and now Anna is going to talk about the effects of aging
on our bodies. And I noticed on our poll, some of you haven't even hit 60 yet, which puppies, you're puppies.
I'm going to turn 60 in a couple months.
I was going to turn 60. Although I will say that there's a huge difference between how I perceived myself when I was 60 as a sexual person and my relationship to myself and my sexuality now. As an older practitioner, I do work with a lot of older individuals and couples. I also see a lot of younger people. I see people as young as 19 that feel like we might be carrying some wisdom here because we've gone through different stages and we've lived to tell about it. As far as aging bodies, one of the more pervasive aspects is ageism. And it's one of the least talked about isms right now, and there's a lot of isms that we're learning about. But ageism, I think, begins even when we're teenagers, blossoming as sexual beings, and we find out that our parents are having sex, and it's like, ooh. And that's carried forward. The older person is seen as someone not desirable, that doesn't meet the cultural stereotypes of what sexy is, or what attractive is or what desirable is. The marketing, except for the marketing that's attached to pharmaceuticals, that portray people that are connected that have to do with sexuality. So ageism is a huge piece to unpack. I don't know if we put any of those resources in the.
Yes.
Okay, cool. Bodies, yes. Two main physiological passages, shall we say, with aging. And they're directly connected to ageism. For women, it's menopause. Menopause has been considered for many women kind of a death knell of their sexual expression. Physical conditions that may occur and may not are vaginal dryness, vaginal atrophy, which is a thinning of the vaginal walls, and a loss of libido. What's just as significant is the psychological implications of those and the psychological interface with relational tension. If I have tension or resentments with my relationship, boy, it's really easy for me to go, I'm over 50. I don't need to do that anymore. So it inhibits communication about what's really happening. There's also changing bodies. My appearance is not the same. And so self-acceptance, again, is interfaced with what we could say are these aspects of menopause. For men, the big one, that was a joke, is erectile dysfunction. Erections diminish, not for all men, not all the time. Oftentimes that hooks right into if as a man I feel insecure about being able to achieve or sustain an erection. When I have one, I might want to act very quickly before I lose it. So oftentimes ED and rapid ejaculation begin to go hand in hand. So men that have never experienced rapid ejaculation before often experience that when they begin to have any inconsistency with erections. Medical interventions. For these particular two aspects that are directly related to aging, there are lots of medical interventions. Unfortunately, the pharmaceutical company has not come up with anything that's analogous to the Cialis type drugs for women, in that female arousal is so multi-layered, that has to do with health and economic factors and cultural and social factors. So desire and hormone replacement therapy, Kelly can maybe speak to that. But again, it's not that predictable and it's not always effective. And there are so many other lifestyle interventions that can be effective working with some physical aspects of menopause. For men, all the Cialis type drugs, again, which they are vasodilators, but they're not going to address if you're angry with your partner. Also, they're not effective 100% of the time, and they have side effects. The other aspects of aging, and there's so many, and I'm not a medical doctor, nor is Kelly. There's heart disease, cancer, arthritis, Parkinson's, all sometimes long illnesses, and coming back from those often can be frightening, and oftentimes physicians don't speak to them around how you can reincorporate your erotic life. Really touching back with what healthy sex is: pleasurable, being aware, connected. None of those say your body has to be a particular way. What we'd like to nudge you toward today is how to generate healthy touch that's not an elevator to some other kind of behavior. Touch has been conflated with having sex. I'd like to tease those apart a little bit. Kelly, do you want to speak a little bit about medications?
Sure, happy to. Okay, so Anna touched on the little blue pill briefly. So pills like Viagra and Cialis, they can help a person provide an erection if it's difficult to get one or sustain one, and that can be great sometimes. But what they can't help you with, what Anna touched on also, is your emotional state. If you're upset with your partner, if you're depressed, if you're disconnected from them, you will have an erection, but you will not have a good relationship. The pill that's for women, that's the analog to that, the little pink pill, is almost completely ineffective. It provides a little bit of engorgement. It does not provide desire. That's one thing science has not figured out how to do yet. And we see many, many people in our practices who over time have lost desire for themselves. I don't think that's a function of aging, but it is a function of boredom sometimes. So save your money. Don't buy the little pink pill. Use the little blue pill sparingly, but let's see if we can work on your connection, your ability to be intimate with yourself and with your partner.
Also, other aspects of aging are empty nest syndrome. So perhaps if you have a partner, and I know we have a very attendees, that perhaps you and your partner have focused on raising your children, or even if you're a single parent, you've had your life focused on your children, and when they're gone, who am I? Who am I as a sexual being? Also retirement. Retirement can be a huge transition where there's a sense of self-identity, someplace you had to go every day, and now you're home. Maybe you don't have any hobbies, but maybe you've been distanced either from a partner that you have, or you haven't thought about dating in the last 30 years.
Mm-hmm. Yeah, and retirement can often bring on a crisis in the home. If you've still got a partner and they wonder what the hell you're doing there all day and won't you go do something else for a little while, you're driving me nuts. Mm-hmm. I wanted to touch a little bit on the illnesses that we can, the longer we're on the planet, the more likely it is that we're going to have something go wrong. Either we're going to get an illness or have an accident, or some condition will show up that can be debilitating. So a lot of illnesses themselves and a lot of medications that treat illnesses can impact your sexual functioning or your ability to be emotionally intimate. Like Parkinson's, you may or may not know, in addition to the tremor that we all understand as part of Parkinson's, is also a mask-like quality to the face where there's no affect. So when you look to your partner and you give them the loving look and they look back at you like this flat thing, it doesn't mean that they don't love you. It means that they're having this mask thing happen. That can be very confusing to start with. Multiple sclerosis, depression can be debilitating and exhausting for you and for your partner. A lot of medications, so many medications can have effects or side effects, which impacts your ability to relate sexually or connect emotionally. Antihistamines, did you know that? Antihistamines, decongestants, lots of different types of antidepressants, including antipsychotics, anti-mania medications, MAOIs, SSRIs, meds for hypertension, diuretics, who knew? Some hormones, including Lupron and Zoladex, which are both used for treating prostate cancer and endometriosis or fibroids. These can all impact your sexual functioning. And once that happens, then that, of course, impacts your emotional connection. And that's where someone like myself or like Anna can step in, or another therapist who can help you to manage your discomfort around what's happening right now with your body, what's happening in your mind, and help you to reconnect with your partner if you have one. Yeah.
All those conditions too, and we're going to speak more at length about communication, but it weaves through everything we're speaking about, particularly with illness or aging bodies. And I've worked with couples that perhaps you see a partner not addressing a particular kind of a condition. And so there's anxiety about what can happen. Maybe they won't see a doctor. Maybe you're resentful because they won't take care of that. So communication, and we'll unpack more about how you can become more practiced at it, but it's just a huge piece that weaves through everything that we're speaking of. Even taking any kind of Cialis type drugs, sometimes men begin taking them and don't tell their partners. So that can be really disruptive and disorienting. So communication is a thread that runs through all of what we're speaking toward. Building a capacity to be able to speak, listen, and experience what can often be awkward, uncomfortable, and super scary.
But we'll help you with that.
Yeah.
Yeah. So, well, there was some other thing I wanted to say. Oh, you know what? I had this thought while you were speaking, Anna, about ageism being a really difficult thing. And, ageism is not just something that comes from the outside world. It's not just your culture telling you you're old and you don't matter anymore. Ageism can be internalized. And we're made to understand that when we hit these certain points in our lives, that things change. Speaking as a menopausal woman, there was a bunch of years in the middle of there when I became invisible, when I would walk through the world and people who would have at least made eye contact with me as an attractive female just skipped me like I didn't exist at all. And so that doesn't do anything for your internal ageism when you realize that I'm invisible now. But also these other things, the things that we tell ourselves about being viable sexually, and if it's based on a particular way of functioning or a particular way of looking or moving through the world. And almost none of that is true. If you can keep sourcing yourself back into the reality of who you are, the body that you're moving through the world in right now, your open heart, your curious mind, how you connect with other people. I almost said that'll keep you young. It'll keep you alive. That'll keep you alive. Yeah. So I'd like to help us practice sharing something. Oh, you know what, Anna? I think you wanted to do a little practice first. You want to do that first? Yeah, let's do our little practice first.
All right. So kind of moving into how do I talk about these things? I don't know about you, but I was absent on that day of school where they handed out the textbook for the successful erotic life. And, I also learned, I was conditioned by media and culture that I was responsible for other people's arousal. And we'll uncover some of those in myths, of which there are so many. But oftentimes when we meet someone, it's like, there's not a lot of investment. It's like, this is who I am, this is how I feel, this is how I feel about a few things, and this is all dependent on, what you feel comfortable revealing in any case. But without fail, as our relationships become more enmeshed, I become hypersensitive. If I bring up this subject, I notice you get uncomfortable. If I initiate a particular kind of touch, I notice you withdraw. And in the beginning of the relationship, this kind of limerous phase where I idealize you, I tell myself, well, I love you. I don't want you to be uncomfortable. So I begin to avoid those subjects. I withdraw from that kind of touch. I tell myself, it's all about you. But really, it's all about me. If I really showed you who I was and how I felt and what I wanted, you won't love me. And what happens over time in committed relationships is we become more and more distant. I'm sure that we all know people that live with partners and they live very separate lives. If you tell me you love me, there's a part of me that goes, love me. You didn't even know me because I don't show myself anymore. Yeah. Would you agree with that, Kelly?
Yes, I totally would. Sometimes even confronting that the what do you want conversation is really difficult because you might assume you might know what your partner wants and you don't want it. You know that that's not what you want. And it might be very difficult to even entertain that. It's easier to just not talk than to know that you're letting someone down or that they're not interested in what you have to say. I'm going to give you some courage to ground in yourself and know that even if you are clear about your desires, it doesn't mean that anyone has to fulfill them for you. It's not your partner's job. It's not your job to take care of them either.
So, speaking of grounding ourselves, I'm going to do a short little exercise. It is possible to be engaged sexually or with touch and not feel our bodies. In fact, many people that have experienced any kind of sexual trauma have been very successful at dissociating from their bodies. So let's take a little quick trip in. I'd like you, if you don't mind, to close your eyes for a moment. Close your eyes and just open your senses so perhaps you can feel the pressure of your body and the surface on which you're sitting. Maybe notice the air as it touches your nostrils, the breath. And I'd like you to bring into your mind, and you get some choices here. It could be someone you really love, that you feel really comfortable with. It doesn't have to be a partner, it could be a child, a parent, a best friend. It could be a pet, a dog or a cat. It could be the way you feel by yourself when you're in nature. As much as possible, I'd like you to be a scientist and begin to track, what's my breathing? Where do I feel my breath in my body? How's my heart rate? What about the musculature? The muscles around my face and my shoulders. Just sense that. Sense the experience of the body when you have an experience of safety and comfort, pleasure. Now stay there. I don't want this to be too jarring. But we're going to make a little pivot. And that pivot is, I'd like you to consider just what you might want to say, either if you have a partner to a partner about what you want or what you don't want, or if you're single and if you're on a date and you'd want to talk about what you wanted or what you didn't want. Notice if there's any difference between that sense of like, feeling more expansive in the body, feeling your breath, and then just your thoughts Do you notice that your heart rate becomes a little more rapid, or there's a little tension in your body, or there's almost a sense of withdrawing? And you can open your eyes. Perhaps a little bit useful. What did you notice, Kelly?
I was ready to just go away in there, just take off. I'm a single person these days, and the contrast, actually it was contrast for me, of feeling that relaxed and open in my body, and then thinking about bringing up the realm of what I would like and how I want to connect with someone I don't know very well. That's definitely can be really delicate and sensitive. And I've had that conversation a couple times in the last year. And yeah, even, I teach this, and it's a thing. It can be a challenge.
Yeah. So what we're moving toward is this is a somatic practice. We can talk about these concepts. We can talk about exercises until we're blue in the face. But what's happening in the body often is contradictory to what our mind wants to do. And that's often how we find ourselves in circumstances that aren't comfortable because we're not paying attention.
Mm-hmm.
As far as beginning these conversations, and first I'll speak to people that might be in long-term relationships, I want to encourage you to start small. To go from, I've never been comfortable speaking to you for the last 30 years about my intimate life, to suddenly being able to say, this is what I like. I've never liked this, and I've wanted to tell you. That's a huge step. What I suggest is talk about your discomfort about talking about it. In the poll, I noticed that we have a number of people that boy, sex is how I feel connected. That's how I feel loved. That's how I feel desired. And oftentimes it seems like a cruel joke that, there's one person that, this is where I feel home. And for another partner, it might be a place of trauma. It might be a place of pain. It might be a place of fear. And so when often the partner that's a little more comfortable communicating might say, I so much want to know what you like, what you want. And that partner might say, I'm so not comfortable talking about that. A great place to follow is, tell me more about not being comfortable. Because if what I'm really wanting is intimacy, that's going to begin to create a field of, oh, I care, I matter. It's not just about achieving a particular behavior. It's not because my partner wants me to have more sex with them, which is often how those conversations are structured. I want to talk to you about sex because I want to have more of it, or rather than be curious on what are the things that are in the way of us becoming more intimate, more close.
Yeah. And so if you can, I was going to say, if you can shift your thinking, I don't know what your thinking is because I'm not looking in your faces right now, but what I hear from the people who speak with me in my practice is often then when they're having difficulty, they have an orientation about sex being something they get, or something someone they have to give, or someone is going to take from them. And if that's you, I want you to try to reorient yourself to think about it like a collaboration, something that you're building with someone. You're finding out about this. You don't know what it's going to look like, and neither do they. You may have your preferences, you may have things you want to explore, but you're collaborating. It's not like you show up with a list and go, this is what I want, and this is what we're going to do. Well, that's not going to go very well. Well, maybe in some circumstances that could be fun, but in the long run. And I've prepared a list of questions for you, Beth and Kira, if you want to, I don't know, you're going to screen share those or just put them in the handouts. I'll go through them right now. Here's some really helpful things that you can think about, things that you can ask or things to share. around some kind of an intimate encounter. And you want to be, yeah? No? Okay. Some feedback for a minute. So you want to be able to talk about what's happening before to set the thing up, during to give useful feedback, and then afterwards so that you can process what happened and then prepare for the next time too. Screen sharing. Okay. Is that the right one? Yes. Okay. So things that you can ask and say beforehand are saying, I'm nervous and I want this to go well. If that's how you feel, and you might feel nervous, or I'm afraid that you'll feel pressured. I'm really looking forward to spending this time with you. Maybe my body feels unreliable and I don't want to disappoint you. So what you do by saying things like that beforehand is you put your anxiety out on the table. And sometimes that's all you need to say. I feel nervous about this. And you may feel instantly less nervous. And then your partner can know, oh, this is what's happening inside you, and possibly adjust to it. During an experience, it's wonderful to express gratitude for things that you enjoy. For example, if you're having a sexual experience, I love when you touch my breasts like that. Or it feels really good when you hold my soft penis for a while. Or thank you for using extra lube. Penetration's easier and it feels better. If you've never said things like that in your life and you're blushing right now listening to me, baby steps, try it. Just little tiny things, just little things. It's going to help you. And then afterwards, you want to process what happened. For example, asking, what did you love? How could we make this better the next time? And what didn't work for you? What would you like to do instead? This demonstrates caring for your partner. You want to be able to be curious and to collaborate with each other about what's happening so you'll have better experiences.
So what we haven't mentioned is, I think there's about 60 of you on this call, 55, and there's a high probability, whether you're single or partnered, that perhaps you have not had any sexual contact in a number of years. And there's a high propensity of a percentage of coupled partners, and this goes across ages, that begin to withdraw from sexual contact after 2 to 5 years. And the longer, it's one of those things, the longer you withdraw from sexual contact, which also gets conflated with touch. I mentioned that earlier. Again, touch and sexuality have become conflated. If I'm the low desire partner, and low desire or disparate desire is one of the more common presenting issues that we see in our practice, and I notice there's a number of professionals here as well. I'm sure they would agree that oftentimes the low desire partner begins to withdraw from any kind of touch because they have anxiety that if I touch you, even in a comforting, nourishing way, if I hold your hand on the couch or I hug you when you come home, you're going to think I want to have sex. I don't want sex. I just want some touch. And those individuals begin to live in the desert. Nobody's receiving touch. The benefits of touch are well documented. It boosts the immune system. It creates a sense of well-being. And back to what both of us are saying is begin with baby steps. If you're in a relationship that has not had touch for a very long time, please start with your clothes on. Really create a safe container. Perhaps talk about what you miss. I miss being close to you. I miss smelling you. And I have anxiety that we haven't been intimate for a long time. I don't know if I'm ready to go there yet. Can we sit and hold hands while we watch television? Can we go for a walk and hold hands? Can we spoon each other with our clothes on? So again, bring it down. You know,
Yeah. And Anna and I are both pretty skilled at guiding people into constructive ways to have touch that are non-sexual as well. And to be able to have a conversation in a room with another person to hold it for you, where you can say, I'm not interested in sex, or at least not the way we were doing it, but I do miss touch. How can we do that? How can we have this without making me feel unsafe by going to there? And so I don't have to cut everything off, because that's not good.
This is an interesting thing. And I also, I know this talk is about sex, love, and aging, and we've spoken a lot about sex and not a lot about love. And I took my walk this morning, and I've listened to a podcast that Kelly and I have both listened to, and it's going to be in your notes, and it's called Dating While Gray. And some of them are more relevant than others. But today there was an interview with Helen Fisher, and Helen Fisher is probably the most well-known anthropologist on sex and love. And she talked about the part of the brain, and that's what she does. She puts people in MRIs, people that are in love, and she documents what parts of their brain gets fired. And the part of our brain that gets fired when we're in love is the same part that gets fired in other strong emotions. And she put young couples that were in love, but she also put in couples that have been married for many, many years that also felt in love still after many years. And the same parts of the brain were ignited. So that is just to say, we don't age out of being in love.
Or the possibility of being in love. So being in love is actually a recognized medical state, but loving is not.
Right.
So, and the being in love thing, that, you know what I'm talking about, that crazy, can't get enough of that person, can't stop talking about them, maybe don't need to sleep much nor eat. Yeah. You don't ever get too old to have that experience. And I've had a couple of older people tell me, oh, I'm too old for that. I'm like, oh, no, you're not.
Mm-hmm.
It's okay. You can still have that. Yeah, but love, so sex and love are sometimes related, and they sometimes show up in the same time and place, and often not. You can have sex without having love. You can have love without having sex. So, yeah, we're going to say about that.
Not a moment.
Okay.
Yeah.
So, yeah, I want to help you have frank discussions about what it is that you're up for. If everyone could wake up every morning and ask themselves, what do I want today? Really, in a deep way, not just what do I want for breakfast, but, how do I want to live my life? What do I want in terms of closeness or distance or solitude or connection every day? Then you'd know what to do with yourself. It'd be easier. And if we have some frank discussions of the 5 journalistic questions, who, what, where, when, why, or how, is why in there? I'm not a journalist, I don't know. But, what would include, what do I like? What do I not like? If you can have a discussion with your partner, or at least yourself, about, name a couple things that I actually like. Name some things that I don't like, just to be clear. When you want connection, how often? For what length of time? I'm thinking about an erotic connection. There's this misconception that all women want hours of intercourse. That's not true. I think that's something that's been sold to us by porn and male enhancement products, but it's not true. Ask around before you make that assumption. And all the rest of those questions. So we have a better idea of how to manage ourselves and how to engage with other people. That'd be helpful.
What do I want?
Beth, a question just came in on this subject, if you'd like me to read it to you.
Sure.
Okay. What should one do if you're willing to openly talk about pre-sex and post-sex, but your partner has a difficult time to be open talking about this just about any time? There's no oral or verbal expressions even expressed during the sex act as well, mainly silence, going on for many years, older individuals married for a long time.
Thank you for the question. It's a great question. Anna, do you want to?
Oh, hmm. I would I would go to, I don't know if you've ever done any kind of therapeutic work that could be really helpful. There's an infinite number of reasons that might be inhibiting those kinds of conversations. Like I mentioned before, a question might more be, tell me more about not wanting to talk about it, and be very curious about that rather than related to intimacy in and of itself. So again, we don't know you at all, but I don't know how comfortable your partner is talking about other aspects of their life. If I don't know if it's somebody that's living in a male body. Sometimes it depends on infinite factors, family, culture, how we were raised to feel comfortable and safe speaking about those kinds of intimate things. So um, I would start with being honestly curious without any objective of we're going to have more intimacy or better intimacy if
Yeah.
we can talk about, but be super curious. Um, I also, boy, at this point, time's short, and I want to practice kindness and compassion to the degree, to let any partner know it's like, I really care. I really care about how you feel. And I realize in all these years, perhaps, I have my own habits of how our conversations have gone, but maybe I want to be quiet and get better listening. Um, are you interested? And that's the question I end with. Are you interested? Because if they're not interested, that's a different conversation.
It's not a conversation
But
if they're not interested.
there's consequences of
Mm,
that, and you want to let your partner know if they're not interested, what are the consequences?
mm, mm.
Um,
Yeah, and I would say also, if your partner doesn't want to talk about anything having to do with sex, it's probably based on a lifetime of knowing that there's shame around sex, and possibly insecurity about, if I don't ask you if you're happy with it, then I'll never know that you're not. So if we don't talk about it, then I don't know anything about it. And what you can do to start with is start speaking yourself, express yourself, go first and say something like, I would really like to kiss you for a while, and leave it at that. And that however it is that you want to show up, the things that you would like to have in your pre-sex, sex, and post-sex, which, if we're speaking honestly, it's kind of one long thing that has a bunch of different features in it. Um, and if your partner is interested at all in exploring at any kind of depth, and it sounds like by now you're a little frustrated that this has never happened and you would like this. So, dragging them by the collar in to see one of us probably is not going to be the smoothest move, and you might not get good results from it. But there are other ways to really just take it for yourself and express, well, I would like to talk about this. I want to tell you about how it was. If you go back to the list of questions that I put up, I would like us to have this kind of an experience. And then during the experience, maybe express your gratitude. I love when you do that. Or I wish you would do this. Or did you like it when I did that? And then afterwards, again, go over, even if it's just one-sided and all your partner does is go, then at least you're starting for yourself, and you're also opening the door for them. Okay.
yeah. I love the question you posed, Kelly. What do I want?
Mm.
And for many people, we've never given ourselves that option.
Or no one has asked. Yeah,
No
no,
one has
ever.
asked.
Yeah.
No one has asked. And even when given the opportunity, we don't know.
Mm-hmm.
Again, there are a lot of really useful um, books and online platforms that you can maybe get practice with those kinds of questions. Excuse me, but in the beginning, it's really helpful to have a facilitator, and we're certainly not here to promote ourselves. But it could be sometimes churches or community centers or libraries actually have programs where you can just get practice with asking those questions of yourself. and really to create a really healthy connection and intimacy. There's 3 pieces. The first piece that I ask people to consider is to take 100% responsibility for themselves. And we all come in with stuff, fear of rejection, criticism, issues of anger, previous trauma. I am actively working at clearing, healing my material. I am not attempting to manipulate my partner so I don't have to deal with my stuff. And I come back to that again and again and again. Am I taking responsibility for myself? Am I communicating in a way that's not defensive, that's not making my partner wrong? Am I being able to follow the thread of what's happening? What do I really want here? So the first piece is knowing what I want. And if I don't, what can I do to find out? And taking responsibility for myself and how I'm showing up.
Yeah, that's lovely. You know, when we're talking about asking, what do you want? I have this image. Once I was in Seattle and I was standing at a bakery window, and the window was filled with cookies. They had, I don't know how many varieties, so just stacks and stacks and stacks of cookies, dozens of kinds of cookies. And in front of me was a mom with a 3-year-old, and she's got the 3-year-old by the hand and she's saying, just pick one, just pick one. The poor, he was in tears. He doesn't know what any of those things are. Cookies are maybe in his world chocolate chip, maybe peanut butter, that's it. Don't ask me about all these other things. So if it feels bewildering, or if you only know like, well, what could I want? I don't even know what I could want. We've got resources. You know, I didn't put it on the resource list, but there's this great listing called the Sexual Inventory Stock List, if you don't know what you want. And that's the thing that I use all the time as a diagnostic tool to help people realize that they do have boundaries and they do have preferences. There are things that they would prefer and things that they would not prefer.
And you can change your mind.
And you can change your mind. Yeah. So it can help give you voice to, what do I want? Which can change today, from this morning to this afternoon. You can change what it is that you want, what you're interested in, what you're open to.
And that change can happen in the middle of something. You know, so we're back to consensual. I might say, well, you know, I'd like to try that. And in the middle of it, it's a no. Oftentimes, you know, I don't want to break the mood. I don't want to hurt my partner's feelings. But consensual means consensual all the way through. You have the right to change your mind.
Yeah. And the other part of that is when your partner changes their mind and you're upset about it, you have to be a grown-up and manage your own feelings without making your partner feel bad or wrong for changing their mind or not doing what you want them to do. That is a very big deal. And you know, when I'm teaching to rooms full of people struggling with addiction, that's a very big issue. What do I do with my frustration? Without acting out, without doing something mean, or without doing some kind of self-harm thing because I'm upset. Yeah.
I have a great analogy for this. Is like, you know, if I came home and said, you know, Kelly, would you like to go out for Chinese food? And you would say, I don't feel like Chinese food. And I go, well, how about Italian? And you go, oh, I don't know if I feel like Italian. You wouldn't think that I didn't want to eat. You would just think, I don't want to eat those things. So often we, again, attach a personal sense, self-acceptance based on someone's no. And the appropriate response, even if someone's unskilled and going, I don't like that, or stop doing that, the appropriate response is, thank you. Of course, I want to touch you in ways that are pleasurable. Now that takes practice to get that one at the tip of your tongue, but even if you can catch it, even if you could catch it a few seconds after, it's like, oh, my feelings are hurt. Oh, I'm sorry. Thank you. Of course, I want to touch you in ways that are pleasurable.
Yeah. Okay. So we're coming up in the end of our time. Today, we have spoken about changing bodies and changing lives, how change is real, but it doesn't have to take you down. We've spoken about practicing sharing your feelings, how difficult that is and how important, your fears and your triumphs. We've talked about countering unrealistic expectations and finding realistic models. And we've talked about a whole bunch of other things that are kind of tucked in there and around too. Is there anything else that that you'd like to say, Anna, before we open up to questions?
I'd just like to throw out some of the myths. And
Throw those myths.
yeah, just a few of them. I'd like to start with one, and I just like really brief little story here, because I saw what Kara sent out. We could go a little longer. Of course, since it's going to be recorded, you'll have this to go to later. But really, one of the main drives, aside from my old parents that didn't tell me anything, that moved me to this work is my former husband experienced sexual trauma through a church and other kinds of sexual trauma. And for the first number of years of that marriage, they were willing to go to workshops and therapy. And I just became fascinated. But their first teacher was a young man from the Bronx, Eddie Adderbar. I don't know if you're listening, but Eddie Adderbar said, "Women have teeth down there." When you're a young boy, that can be horrifying.
When you're a young girl, that can be horrifying.
Right. Or I remember in my personal one that my mother told me somewhere, I think I was probably in my late teens, that women had 3 holes. And that really contradicted what I'd learned in my Girl Scout meeting. But she was my mother. And then when I got pregnant, I took a diagram to my mother, who by then was in her 60s, and I showed her. And she just looked and said, "Isn't that interesting?" So a woman that lives most of her life without even knowing her own biology, her own physiology. Real common myths. You're supposed to know what to do. We were all absent on that day. And being a wonderful lover takes skill and practice, communication, patience, open-heartedness, deep kindness, and a sense of humor, I think, is really crucial. Another myth is it's always supposed to be good. Now, the analogy I have for that is my refrigerator and cooking. Yeah. Sometimes I'll plan some wonderful dinner. I'll find a recipe. I'll buy all these expensive ingredients. I'll put it all together and I'll sit there and go, meh. And another time there'll be 3 things left and I'll whip up something and it's the most fantastic meal. And this just to say there are so many factors around how you connect. Sex, another myth, sex equals intercourse and or orgasm. Sex is so many more things than that.
Yeah. It's a buffet. It's not like sex is this 1 or 2 dishes that you know how to cook really, really well. No, sex is a freaking buffet and there are hundreds and hundreds of things on it.
And it changes as we change.
Seasonally.
And when you begin to have mobility issues, when there's illness, when there's pain, when there's surgery, when you've just been in a body for a long time. There's a beautiful book that's in our resources, the French Woman's Guide to Sex After 60, and it's beautiful, and it gives many, many examples of how our erotic preferences change and our relationships change. The other is a heteronormative myth. Men want sex and women want romance. I've seen that flipped all over the place, and we can put any kind of orientation in there. And I'm sure you all have your own. If we had breakout rooms, I was thinking if we had breakout rooms, they could go and share what kind of myths they had.
If they wanted to.
If they wanted to.
Yeah.
So first of all, I really want to applaud your courage for showing up. And one good thing about this virtual platform, I actually did a presentation several months ago called Virtual sex not as creepy as it sounds. So I investigated all manner of how virtual sex shows up, and I just hit the tip of the iceberg. But one is education. And we can get information now through this virtual platform that for many older adults, you would not have thought of going to a sex shop to go on to a class, or go to your church, or even go to the library, as evidenced by how many people showed up when we were in person last year compared to how many people are here this year. So want to applaud your courage. Thank you so much. We've got resources, how to reach us, but also Psychology Today has a great resource locally. ASEC.com, the American Association of Sex Educators, Counselors, and Therapists, has resources. You can find ASEC certified.
Yeah, they're all on our contacts or on our resources pages, as well as ways to get a hold of Anna and myself, other ways to find therapists, some really interesting things to look at and to read and to listen to. Are you ready to take questions now?
Sure. I just want to say, we didn't say a whole lot about being single and dating, but really it starts with the relationship with yourself. And maybe we'll do another presentation about that.
That'd be fun.
Okay.
I can't wait to see what I have to say about that.
Yeah, me too.
Okay. Beth and Kara, do you want to put up the questions for us?
Yeah, Anna and Kelly, first of all, thank you so much. And I would love to have you back for a presentation on single and dating. That sounds amazing. So we have 2 questions up for you, and then another several questions about the resource list that you've been mentioning. So Kara, do you want to talk about the resource list and sending that out really quickly? Kara?
Oh, sorry that you couldn't, I was talking and I said something highly profound. But anyways, I'll just go on. Dr. Rees, the questions that she went over, the questions to share with your partner, that will be sent in an email to everyone that registered, along with the resources list as well. And I know, Dr. Rees, you mentioned the sexual inventory stock list. If you have a good website to direct us to, I'd be happy to include that as well.
Yes, I do. Shall I give it to you afterwards, or would you like that now?
Oh, we can do it afterwards, and then I'll
Okay.
send it in an email.
Great.
And then we do have, several questions that have come up. Beth, do you want to pick
I'd
one?
love to address, there was one about alternative sexuality that we didn't really say specifically, bisexuality, homosexuality. What I'll say is the elements that we spoke of apply. The ability to be comfortable in your own skin, being able to communicate what it is that you want, what you like, who you are. The question didn't speak to, resources. There are meetup groups, but I have found that ways for older people to meet, particularly around alternative sexuality, and I hope that person that asked that question is still here, they're in short supply. Even dating for older adults, there are some sites that say that they cater to older adults, but the resources for sexuality and alternative sexuality for older adults, and I'll need to do some more resources or more research on that. But the elements of speaking, listening, creating the kind of experiences you want, and there's a lot of discomfort, particularly with alternative sexual behaviors, if you want to introduce them to a partner, and there can be a lot of anxiety about doing that.
I'm looking at the question right now. Can you talk briefly about alt sex for older people, bisexuality, homosexuality?
Yeah,
okay, so I don't know the basis for where the question came out of in you. I do know that sometimes you get to a certain point in your life and you realize that the life you've been living is not the life that you want, that there's something else that needs to come out. And so that's actually one thing that a lot of us can help do. A lot of sex therapists can help you do. I can help you do if this is the question. You feel that the orientation that you've been presenting is not your true orientation. And so we can help you find ways to live your true self, ways to connect with people that would be more supportive of your true self, ways to present yourself and ease yourself into the real thing. If you're in a closet still and your family doesn't know that you're different than you are inside you, yeah, so reach out.
Yeah.
I'm happy to help.
That's another benefit of the virtual platform, because with the
Yeah.
pandemic, perhaps people are living with their families that they haven't lived with for a long time, and they're not out about their sexual behaviors. And so there are virtual platforms to connect with other human beings that are just like you.
Mhm.
And I know that we wanted to say we're all okay. I'm thinking of one call I received many years ago. A person was calling me about a specific sexual behavior, maybe more, I don't want to say a fetish, but a behavior that was pretty on the outside of the realm of what most people are even aware of. And they were curious about, they wanted to participate in this behavior 24/7 with a partner. And what I heard is they really wanted the behavior normalized, but the question about living with it 24/7 are the same questions you'd ask for yourself if you wanted to be in a committed relationship. That we want to be normalized, that what we want is okay.
Yeah. Yeah.
And what we don't want is okay.
And what we don't want is okay. It's fine for you to say yes or no to anything. And I have to tell you, however you're feeling about it is fine. You're allowed to have whatever feelings you're having about. You can be excited, you can be outraged, you can be bored, whatever the thing is, it's completely fine. You're allowed to have your own feelings about all of this. I want to look at the last question here. Let's see. Can we have a list before, during, after? Yep, you got those. And what things I do and don't. So sex with someone in menopause. Thank you for asking. So someone writes in asking a question about having sex with someone who's in menopause. And they want to know, what things do I do and do I not do? They say she produced much less lubrication and don't use external lube. And does age affect how the vulva smells and tastes? Is it the same or does it change with age? These are great questions. These are awesome questions. Okay, so to know what to do, having sex with someone who is in menopause, ask the person that you're having sex with. That's a good start. There's nothing that has to stop happening because menopause is happening. But sometimes if someone is experiencing dryness or atrophy, you might want to be more careful, like physically cautious to start with until you find out what feels good. Definitely use lube. If someone's vagina is drier, it feels dry because it only makes things more comfortable. Even if it feels like, oh, this is artificial and I only want to do natural stuff. There are a lot of different kinds of lube. Actually, there's a great shop in town called Shebop the shop, that has a lot of different kinds of lubrication. None of them are harmful to humans. They do all their research very carefully. They have tons and tons and tons of samples of stuff. So you don't have to pay $20 to buy a bottle of stuff that you can't stand the smell of. You just get a little packet first and figure it out. Definitely use lube. It'll make things better. And does a vulva change in its taste and smell? Yes, constantly. But not specifically that for someone who's old. Yeah, they're all different. And, the more experience you have with different vulvas, you'll realize that, oh, okay, there's a big range. So yeah, hygiene is always good. So if you're the person with the vulva, make sure that you're clean and you want to have somebody entertaining you like that. Did I cover all the question there?
Yeah, I'm looking in the chat too. Another kind of myth about we've been perpetuated by marketing is we're supposed to smell like something that's not human.
like a
Right.
field of flowers. What was that summer's eve douche? Remember from when I was like 10 years old? Is smell like a spring breeze. Are you kidding?
Really
No.
good stuff is messy. It's messy. But
Yeah.
I'm not assuming everybody's down for that. But just saying, there's also a question I saw in the chat that is too big to address, but I just wanted to mention about a marriage that was affected by porn. They use the phrase porn addiction. There is a lot of clinical evidence that porn can be a compulsive behavior, but oftentimes it's covering a lot of other kinds of longings. And we can speak more about that. But Esther Perel has wonderful material for many people. Porn often is seen as a break in fidelity. It's seen as a betrayal. And so how to repair from that, there's a lot of resources about it. She's a great resource.
Yeah, Esther Perel. Also, another really good sex therapist, Marty Klein, has a lot to say about porn use in relationships. And it's what I notice is when someone comes to me with a porn issue in a relationship, it's everyone's feelings are hurt immediately from the get-go. So I would suggest having a consultation at least with someone like Anna or myself or another sex therapist that can help you walk through that. Marty Klein has a different take on that. He's said often in marriages where the marriage is ending and porn is blamed, porn is the blame for the end of the marriage. He would say that the end was coming already and porn is trying to be the solution.
That's great. Yeah. I think we're just about out of time. Are we right?
Yeah. Quarter past 12.
Yes, we are. We're at time. Just really quickly, the resource list, does that include, I think you did say it includes some things on ageism as well?
Yes, This Chair Rocks and Yo, Is This Ageist are websites run by a friend of mine who's an amazing, she's a vigilante anti-ageism activist. She's wonderful. And she's come to Portland a couple times.
All right. Wonderful. Thank you. I'm going to stop the recording now.